Welcome to podcast episode 250. I'm Stuart McCullough. I'm the CEO of VHIA. And joining me for today's discussion is Senior Workplace Relations Consultant, Maria Kopilas. Good afternoon, Maria.
Hi, Stuart.
Maria, you've done this before. You know there's going to be a clue, and the clue will suggest the subject for today's discussion. The clue is currently on screen, but for the benefit of those people who are listening to this podcast rather than watching, could you describe it? For the audience?
So it's an image of an ink blot test, or otherwise known as the Rorschach test.
The Rorschach test. I didn't know what a Rorschach test was, but it's definitely the name of my next band. I'll say that much. So I understand that's a psychological test in which a person's perception of ink blots is used to examine personality characteristics and emotional functioning. So based on that clue, I can tell we're going to go deep. But what would you say is the subject for today's discussion?
So I'd probably say it's psychology related.
So that's what you get from the ink blot?
Yes.
I'm going to go out on a limb and say that what I see when I look at that ink blot that's currently on screen is I see a bear jumping over a campfire. But I'm prepared to accept that psychology is a much, much better answer.
Yeah, I think that's a lot better than the bear.
So that takes us to today's subject, Maria.
Yes. So today's subject is the implementation of psychology entitlements under the Medical Scientists, Pharmacists and Psychologists Agreement, and also the Memorandum of Understanding, which sits separate to that agreement.
And I know there's been a bit of confusion as to how those two things interact. They are different, even though they came out of the same process, but the MOU sits separately to the enterprise agreement, and it's negotiated directly between the department and the MSAB, and VHIA is not a party to that.
That's correct. So VHIA was consulted on those MOU terms, and we've been consulted in part around implementation terms, although we're not party to that MOU.
So we didn't negotiate it. Can you take us through a summary of the key changes, though, starting with the enterprise agreement, the key changes that are applicable to psychologists?
Sure. So some of those key changes include the insertion of a new clause at 94 to provide psychologist supervisor training. There's also amendments at clause 95 for clinical supervision, insertion of a new clause 96 around limiting restraint of patients, new clause at 97 for the provision of amenities, and amendments to Schedule 3, including the expansion of examination leave to Grade 1 psychologists, a new clause to facilitate progression from Grade 2 to Grade 3 by request, and minimum grading for director and educator roles at specific health services.
So quite a few different pieces. So those are the changes that come from the enterprise agreement. Various locations, we'll go through them in greater detail in a moment, but what does the MOU cover?
So the MOU primarily deals with the appointment of additional EFT, and that includes the addition of 85 EFT of psychology registrar positions that are to be appointed each year across public health, and that's comprising 75 in mental health and 10 in allied health roles. Uplifts to director classification grades at certain health services, and appointment of additional educator roles at certain health services.
All right, so that's the overview with regards to the MOU. Let's get into some detail. And starting with the enterprise agreement changes, could you take us through the psychologist supervisor training at clause 94?
Sure. So clause 94 provides that where a psychologist meets their PBA requirements, they'll be approved to undertake supervisor training upon request. So where that occurs, the employer will pay reasonable costs associated with the training.
The obvious question there, Maria, is what is a reasonable cost?
So reasonable costs have been defined within the agreement, and it includes but is not limited to course fees and time release without loss of pay to undertake the training.
In terms of those requests when they come, is there a time frame that's prescribed by which to respond?
Yes, so employers must provide their response within 14 days.
And moving on from that clause to clause 95, which is the clinical supervision of psychologists. This isn't a new clause and has only had a few minor tweaks, but could you highlight the key changes?
So that's correct. So clause 95 has only had some minor amendments to include the grade 3 supervision requirements, which previously sat within Schedule 3. So there's no actual change to that entitlement. However, it now includes supervision requirements for grade 6 positions.
The grade 6 position is a new addition to the agreement. What are the supervision requirements for those roles?
So the new clause is provided on screen, and it states that the employer shall support the grade 6 psychologist to seek external supervision from another senior psychologist. This support includes payment for supervision and time to attend supervision. External supervision arrangements will be agreed between the psychologist, the employer, and the proposed supervisor.
So Maria, why is it that for a grade 6 psychologist, the supervision is external?
So all psychology positions will receive clinical supervision from someone who's classified at a grade higher than themselves. In the case of a grade 6, that's the top classification within the psychology structure. So the alternative is to provide for external supervision for these employees, as there's nobody else sitting above that classification.
So let's move on from clause 95 to clause 96, no restraint of patients. In a sense, the title makes it quite self-explanatory, but states that psychologists will not be required to physically restrain patients. Are there any exceptions to that rule?
Yes, so the only exception provided in the clause is in the circumstances where there's an immediate duty of care to maintain safety.
So does this impact on a psychologist's ability to participate in de-escalation, for example, or other forms of non-physical restraint?
So no, this clause is limited only to physical restraint of patients and will not impact on other forms of de-escalation or code response.
So moving on from clause 96 to clause 97, amenities. Marie, could you take us through this clause?
Sure. So the main entitlements provided at clause 97, subclause A, and that states that a psychologist will, as far as reasonably practicable, have access to an office space, technology, including a computer and or laptop, telephone and mobile phone and storage facilities, and clinical spaces to see patients. That's appropriate, having regard to the work that's performed by the psychologist, including the need for privacy in clinical and professional activities, including clinical supervision and leadership responsibilities.
It's interesting to see the different components within that provision in terms of as far as reasonably practicable, but also taking into account having regard for the work performed by the psychologist. And I recall in bargaining there was lots of discussion about some of the tasks being performed by a psychologist are quite sensitive as such. But those do seem like fairly common amenities that are generally provided by employers where possible. Are there any other requirements under clause 97?
Yes, so subclause B provides further that having regard to the clinical duties performed by a psychologist, and as far as reasonably practicable, a psychologist will not be required to share clinical spaces or hot desk for the purpose of performing clinical duties. In the event that a psychologist is required to share a clinical space or hot desk for the purpose of performing clinical duties, the employer will, as far as reasonably practicable, give consideration to alternatives such as remote working locations, and that includes work from home, or appropriate on-site breakout space. Agreement to alternative arrangements will not be unreasonably refused.
Really interesting. Continuing on that theme, Maria, it's really directed towards ensuring that the space that's being utilised is fit for the work that's being undertaken. So what is the entitlement if a psychologist works from home?
So where a psychologist performs work from home and or undertakes consultation using telehealth, the psychologist will be provided with appropriate equipment, including mobile phones and computers and secure communication software.
So what happens if an employer is unable to meet these amenities requirements?
So if an employer doesn't meet the requirements of subclause A and B above, an employee is able to raise concerns with their supervisor. The employer will then develop strategies to mitigate concerns if the concerns cannot be immediately resolved.
Okay, so that makes sense in terms of if you can't meet that meet those requirements, then mitigation. So moving on from the body of the agreement into Schedule 3, one of the first changes is to introduce access to examination leave for grade 1 psychologists. What's the rationale behind that change?
So as grade 1 psychologists only have a provisional registration, they are required to undertake an examination to obtain their general registration. So the expansion of existing exam leave entitlements will help to support these employees in obtaining their registration.
One of the biggest changes, Maria, to Schedule 3 was the inclusion of Clause 14.2, psychologist grade 2 to grade 3 progression. Could you take us through that clause?
Sure. So this clause provides a mechanism for employees to request reclassification from grade 2 to grade 3 if they meet that criteria.
So what is the criteria for progression?
So subclause A provides that a psychologist grade 2 may request to progress to grade 3 where the psychologist has endorsement from the PBA in an area of practice, has a minimum of 5 years experience as a generally registered psychologist, performs complex clinical work of a psychological nature as part of normal duties, and 4 is a PBA approved supervisor.
Just want to pick up on that point around experience. So does experience that's gained as a provisionally registered psychologist count towards the minimum experience requirement here?
No, for the purposes of this clause, the only experience that's regarded is that of a grade 2 psychologist.
So an employer is required to respond to an application within 28 days. What happens if an employer refuses an application?
So if an employer refuses an application, they must provide the details of the reasons for refusal in writing to the employee.
And in terms of reasons for refusal, can an employer refuse for budgetary reasons?
So no, the agreement is quite clear that the reclassification is based solely on whether an employee meets the criteria at subclause A. An employer cannot refuse a reclassification if there is no vacancy or budget for the grade 3 position.
So we've identified the reasons that you can't refuse an application, that is budgetary considerations. What are the reasons by which an employer can say no to an application?
So an employer may only refuse to progress a psychologist who meets the criteria at subclause 14A, where they are able to demonstrate that there is no grade 3 work available.
So I take it from that progression is on the basis that you will be undertaking the work of a grade 3 once reclassified?
Yes, that's correct.
And for those who are refused, can a psychologist reapply for reclassification after refusal?
Yes, they will be able to reapply for a reclassification after 12 months.
So now we've discussed the substantive changes to the entitlements under the agreement. We can move on to the appointment of new psychology roles under Schedule 3 of the agreement, as well as that MOU. So firstly, we've got that introduction of the new grade 6 director classification.
So the grade 6 role has been introduced as a new classification within some of the large metro and regional hospitals. So the classifications have been included in both the agreement and MOU and set out the health services who must appoint into these roles. The list of relevant health services are provided on screen. However, I will go through them. So we've got Alfred Health, Austin Health, Ballarat Health Service, which is now Grampians, Barwon Health, Bendigo, Eastern, Melbourne, Monash, Northern, Peninsula, Royal Children's Hospital, Southwest Healthcare and Western Health.
One of the queries that always comes up with these kinds of outcomes is whether these roles are new EFT, new appointments, or whether it's a case of existing directors being uplifted into that new classification. Do we have any clarity on that question?
Yes, so this is a question that came up from members and we discussed it with the union and department not too long ago. The parties had agreed that the intention was to uplift an existing role to the grade 6 level as opposed to recruiting a brand new position. So in the event that a health service has 2 existing employees in a grade 5 position, for example, it's recommended that an expression of interest process is followed to recruit into that role and appoint one of those individuals up to the grade 6 level.
Sticking with Schedule 3 and in particular Clause 13C, that also provides a list of employers that need to appoint Grade 5 director positions. Should the same approach be taken to these roles?
Yeah, that's correct. So for the benefit of those watching the podcast, we'll put up the list of health services on screen. So Grade 5 directors will need to be appointed to Albury-Wodonga Health, GV Health, La Trobe Regional Hospital, Mildura Hospital, Mercy Public Hospital, Peter Mac, and also St Vincent's.
It's obviously a change to the structure. It may change, affect reporting lines and the like. Is there an expectation for employees to undertake a formal change process where a position is appointed under Clause 13 or Clause 14 of Schedule 3?
So there are requirements under the agreement to consult where there are changes to reporting lines. However, as these appointments are part of the agreed outcome of this enterprise agreement, the union would support an expedited form of consultation. So they've communicated to us that there's a preference to do it as quickly as possible to try and encourage implementation.
So how would you recommend employers go about that expedited consultation process?
So employers should get in touch with their union representative in the first instance to advise how they plan to implement the new director appointment. So whether that is uplifting of an existing employee or whether there's an expression of interest process or however that looks. From there, the parties can agree on the most efficient approach to local implementation, and that will depend on the changes that are necessary.
So moving on from that to the psychology educator positions, the MOU states the additional EFT will be appointed to health services. Can you take us through that provision of the MOU?
So the clause says that psychology educator positions will be at the grade 4 and 5 levels, and these roles are to continue the ongoing professional development of psychologists. So specific psychology educator FTE will be allocated as is provided on screen. So you can see the grouping of hospitals. So you've got Alfred, Austin, Barwon, Eastern, Monash Peninsula, Royal Children's, Southwest Healthcare, Northern Health and Western Health that'll get 1 EFT of grade 5 and 2 EFT of grade 4s. Royal Melbourne will get 1 grade 5 and 2 grade 4s. The Centre for Mental Health Learning will get 1 EFT of grade 5 and 1 EFT of grade 4. And then Albury-Wodonga, Ballarat Health, Bendigo Health, Mercy Health, Mildura, Northern Health, Peter Mac, La Trobe Regional Hospital, St Vincent's Hospital, Western Health and GB Health will get just the 1 EFT of grade 5 educator.
Is there an expectation that the educator positions will be additional EFT, or as we discussed before, are they uplifts to existing roles?
So the educator roles will be treated as additional EFT as opposed to uplifts in the case of the director positions.
Okay, so a difference in approach. That takes us to the psychology specific item that's within the MOU about registrar appointments, which is also known as grade 2 psychologists. The MOU states an additional 340 EFT of psychology registrar positions will be recruited over the life of the agreement, and the parties would consult on how that was implemented. First of all, what does the breakdown of EFT look like?
So the way that this is structured is the uplifts for each year. So that's from 2022 to the end of the agreement. So that's 75 EFT of mental health psychology register positions year on year, and then a further 10 psychology register positions in allied health or non-mental health roles each year.
And what was the consultation process with regards to the allocation of this additional EFT?
So both VHIA and the union consulted with employers between September of 2022 and December of 2022 to assess the need for EFT across services. We believe discussions occurred between the union and department heads at a lot of the large mental health services quite some time ago. So through that process, we were able to allocate that EFT and then provide confirmation of outcomes in October 2022 for those mental health roles, and later on in January of 2023 for the non-mental health roles.
So the Department of Health has written to employers about appointing those MOU roles. What communication have they provided so far?
So we understand that the department sent out some correspondence to employees in October 2022, confirming the outcome of the mental health psychology register appointments. And at that time, they requested that employers should commence that recruitment promptly. A subsequent letter went out in January 2023 after we'd resolved the non-mental health allocations. And that one was written in a similar way, requesting that employers appoint into those non-mental health psychology register positions, and also included any sort of psychology director, educator roles, and I believe pharmacist roles were also included in that letter.
So this particular agreement, the medical scientists agreement and the subsequent MOU, this is one of the agreements that has a significant lag between the nominal expiry date and when the next agreement was approved. I think the nominal expiry date was, I think, January 2021. It's gone to the Commission in October, November 2022, so more than 18 months. One of the challenges with that kind of lag is that you've got things that are supposed to happen in 2022 that haven't happened. So we've got allocations for 2022 and 2023. What approach should employers take to that?
So employers will need to recruit as per the letters that were provided by the department. So in some cases that will be inclusive of the 2022-23 funding. And then in other cases, so I believe the non-mental health roles, they've only released funding for the 2022 roles. So there will be subsequent correspondence to confirm how much EFT would be need to be appointed for the 2023 roles. So it essentially means that employers have to recruit to both those allocations this year.
And we know that we do get sometimes queries about funding, and I think those correspondences from the department have a nominated contact point for queries with regards to funding. And we would certainly encourage members firstly to utilise that, and we would love to know if there was any existing concern after that process as such. The last question, Maria, would be, are we providing any additional implementation materials to employers?
So yes, we're currently preparing an FAQ document to assist employers with implementation of the MOU terms. This will be circulated via bulletin once we get that contents confirmed with the department and MSAB. So we're hoping to meet with them in the next week or so to try and organise that. We'll also send out some regular surveys with the first one going out this week to try and track the implementation progress across the board. And that is for the purpose of us being able to report it to the central committee meetings. And those committees comprise of VHIA, the department, and the union representatives.
Okay, so members can expect that survey, which is really just from the point of tracking progress.
Yeah.
Maria, thank you so much for taking us through the psychology changes under the medical scientists agreement and some associated changes under the memorandum of understanding. I don't think there's a better way to end this podcast than to bring back up the ink blot and to stare into it for several minutes on end and just enjoy the splendour of the Rorschach test. Thanks so much, Maria.
Thank you, Stuart.
VHIA.com.